Hello, I'm Barbara Gale from the Democratic City Committee. I'm here for Democratic Dialogue. Our guest today is Dr. Arthur Bloom, who has deep experience with genetics and environmental issues as a physician and a scientist. And I think we'll learn a lot from him. Dr. Bloom, nice to see you.
Delighted to be with you, Barbara.
Thank you. Could you give us a sense of what the work you've done over the years is in various areas?
Yes.
I know you have quite a wide range of knowledge.
Well, I began life in Boston, grew up in Dorchester and educated in Boston, and then I wandered down to Maryland to the Johns Hopkins, where I trained in pediatrics and in genetics.
Wow.
And from Hopkins, it was a short run over to the National Institutes of Health in Bethesda. And that's where I trained in the very newest genetic techniques. I was then invited by the Public Health Service to go to Hiroshima and Nagasaki to employ some of those methods in studying the A-bomb survivors and their children and those who were exposed in utero. And so I spent several very interesting and important years there studying radiation effects. And from there I went to the University of Michigan, where I worked on laboratory methods for studying some of the chemicals and manipulating cells and exposing human cells to chemicals that were potentially carcinogens. And then moved finally to Columbia University, where I was professor of human genetics and of pediatrics. And at Columbia, in the laboratory, had a large program in toxicology, studying the effects of suspect chemicals on human cells, on the genetic material of human cells, and reporting those findings to the National Institute of Environmental Health Sciences, which is a major sponsor for that kind of genetical research. While I was in New York, interestingly, 3 Mile Island occurred, and I was involved in studies of the survivors. Most people survived, of the effects of the radiation releases at 3 Mile Island, and also the chemical disaster up at Love Canal in upstate New York. At the end of all of that, not the end, but while there at Columbia, I went on to the board of scientific counselors of the National Institute of Environmental Health Sciences. The National Institute of Environmental Health Sciences formulated a program, the board formulated a program of systematic research into the effects of chemicals that were potentially damaging to humans. And so that board was an important experience, and it is a major policy board of that institute, as most of the other institutes involved that we'll be talking about.
Yes.
They all have their boards, and they determine programs. So those were the, and I have then spent a lot of time with radiation effects, chemical effects on various populations. The very young children were an emphasis of mine. Those exposed directly in terms of cancer and malignancy formation. So I've had a long history in this field.
As you are aware, there have been a lot of attempts by the current administration to get rid of or damp down some of these very good initiatives that have come from government agencies. When you're looking at what is being proposed, which involves environmental protections of various sorts, what do you see happening in general under the current administration in Washington?
Well, I've used this occasion to review the things that are being done by the administration, the current administration, and I must confess to being appalled by what is happening. There is, first of all, a systematic rollback of Obama-era programs and of programs that were set in place to limit air pollution, to modify climate change, to stop climate change, a lot of those programs are now being cut back.
Yeah.
So that there's a systematic decrease in federal support of those agencies that are involved in regulating air pollution, and in all of the agencies really concerned with environmental issues. There's a decrease, for example, in the scientific input into their boards of advisors, and that may seem administrative, but it really has very practical consequences. If one puts too many non-scientists into determining programmatic items, then the programs lack scientific credibility. And this is one of the major things that is happening in the effort of the administration to open up a lot of things, and we'll get very specific about that in a few moments. But my sense is that the effort is a serious effort. It is widespread, and I think the population of this country and larger population will suffer. The world population will suffer as a result of these changes. There have been major, not only reductions, but absolute cutbacks in major programs. I'll mention just a couple. The program in toxicology testing of chemicals and things that are thought to be potentially damaging to children, to future generations, as well as to be potential carcinogens, cancer-causing chemicals in the environment. Those programs of toxicology testing have been seriously slashed. And I think over really several decades, the scientific community tried to put in place programs which would identify and therefore help to eliminate chemicals like arsenic from the environment. And I think that that's one of the things that I was impressed at, the depth of the effort to suppress all of these things. The carbon monitoring system. When we pulled out of the Paris Accords, everybody talks about the Paris Accords and our leaving the Paris, and that was just a symptom of what is really going on. The NASA had a program called the Carbon Monitoring System, CMS, Carbon Monitoring System, and to monitor the climate and the program, and that has been radically cut out of NASA's budget. Not completely, perhaps, but almost all. So the programs of monitoring climate control, monitoring the public lands that are used heavily by our population, and the sustainable energy programs, those have all been slashed in serious ways in the 2019 administration budget. There is one other thing that I noticed, and I was just appalled by this, and that is that government websites are now amenable to censorship. That is to say, all allusions to climate change on government websites are being removed, systematically removed, so that it's almost a heresy to try to talk about climate change as a real phenomenon, which the scientific community believes in, and it's now verboten. So I think there's an atmosphere. The result of all of this is there is an atmosphere of non-respect for the science in these matters, and a real threat, long-term public health effect to the population, ours and to the world.
Now, you've already provided some specific examples of changes that you think may be dangerous to the health of the population. Is there more that you'd like to say about that? And I guess to some extent, do you have advice to people who aren't as well-versed in this area as you are about what sorts of complaints they might want to make,
well,
if that makes sense?
I think first one has, Barbara, to know exactly what is going on, and I think an educated public will do a great deal. An educated public will not tolerate what's going on as best we can stand for what we believe in. The budget for 2019, for example, eliminated 12 or more key programs on climate change, energy efficiency. I mean, they're reintroducing coal. Well, that's a political move, but it's a disaster for the environment, and we work very long and hard to stop the emanations of coal into the environment, which are very, very toxic. The EPA and the Fish and Wildlife Services have had dramatic cuts, and some of these things are really they involve global climate change programs in the Department of State and the USAID. $1 billion has been cut from the EPA, Environmental Protection Agency, in their grants program, and the Department of Agriculture. And all of these things provide and have been generating, scientists have worked to control the adverse effects of chemicals in the land, so that when we raise crops, those things are not toxic, and we're not using pesticides in the ways that we did. There have been a number of very specific things. The Interior Department, for example, and I'm putting this in the context of each department so the audience will sense the breadth
this is helpful.
of this. The Interior Department is responsible for species protection, and a lot of the things have been eliminated that protect various species. The no poaching rules have been withdrawn. No approaching endangered species have been drawn. The protection of fisheries is sorely being tested now, and things like the otter, the spotted owl that we saw out here at Bass Rocks this past winter, and the coral, things that protect the coral. The chemicals that are released into the environment by heavy industry in particular, it's a mixed blessing. There may be jobs there, but they also provide toxic materials into the environment that damage these things. The National Oceanographic Agency, for example, has canceled all rules to protect whales from the large nets that were being used at sea. So the whale is now a much less protected marine mammal.
Yes.
Then you come to the everyday things that will affect the population. The car emission standards have been rolled back in the EPA. The cuts to there's one particular program I was interested in as a pediatrician, Child's Environmental Health Program, which and disease prevention, which was within the Environmental Protection Agency. That has been slashed. They did simple things to protect the health of children. For example, they found in studying rice, certain kinds of rice have arsenic, which is a known carcinogen and very toxic.
Yes.
And so when you eliminate a program geared to the protection of children, you're really doing a great disservice to the population at large. And these things are going on sort of across the board. And one of the effects, I think, of all of this, is that the scientific community is grossly agitated by these things. The input of the scientific community is much reduced when you put people like Pruitt and Zenke into these major administrative jobs with no experience in the field. And so my feeling is that the public has really to speak to these issues. A couple of other examples. The Interior Department has auctioned leases off of all unleased areas off the coast in the Gulf of Mexico, off the coast of Alabama and Louisiana and Florida, and all of that is now open. The leases are now bought up by industry and will be used to, for oil and gas drilling, purposes. And while that may seem energy efficient for the country in some sense, it is really potentially catastrophic when all of our, lands of that sort are being misused,
Right.
as we know they are.
I had noticed that some of the marine national monuments had been opened up to
Yes,
drilling,
that's
which
right.
is a pretty scary thought.
And the national parks. National parks as well. And
That's right.
They're not as protected as they once were, and several of those parks have been removed from the National Park Service. So all in all, I think there is cause for great concern. One of the interesting areas, I don't know if you're interested in this, but I think the notion of susceptible populations. In other words, as a geneticist, one of my areas of interest has always been the genetically at risk. Those who more than others, by dint of their genes, are at risk. So if you take 100 people, and 100 smokers, not all smokers of those 100 smokers will be equally susceptible to the risk of developing cancer of the lung. There'll be a subset, and that subset is particularly at risk for things like lung cancer, for emphysema and difficulties breathing. And I think that if you stop to think about this, these things require long-term studies. A lot of the agents, we didn't know for many, many years what the health effects of cigarette smoke was, what the effects were. And I think when you stop to think that it's not only those of us who are exposed, just as in Hiroshima and Nagasaki, it wasn't just the people who were exposed, but one of the more important kinds of studies that we did was on the children of those who were exposed, and looking for possible genetically transmitted effects from the exposed parents. And that kind of study is long-term. It takes really many years and large-scale studies, and it's very hard to do it when budgets are shrinking and you can't properly identify the populations that are at risk. So my argument is that we are, as a society, have to be sensitive to chemicals, radiations, all of the things that need testing. There are unresolved issues. For example, for years people have talked about what are the health effects of diagnostic ultrasound. Well, we sort of put that to rest. The data is ambiguous to some extent. Another one is cell phones and the radio waves from the cell phones on the brain. There have been reported to be increases in some studies of brain cancer from people who use cell phones heavily. Well, the effects are not dramatic, and so it's very hard to prove. And that's why long-term population-based studies are necessary.
And especially if you have that kind of warning signal.
Absolutely.
Then you want to do a longer-term study with more people involved.
Right.
Because that, I assume, will get a much firmer answer.
And part of it comes from your family history. If we could take detailed family histories and determine that certain people within a certain group is at risk, it would be possible to recommend strongly preventive measures. And nowadays everybody's doing DNA analysis, and you could test the actual genes for a lot of human-related diseases and their mutations that cause the disease. So this is now a very important stage that we're in. And what's happening basically is an unraveling of what it has taken decades to do. To put in place programs that protect the species of our world as well as us and our progeny. And that's what's going on now, so I think there is a great concern.
Well, I certainly share your concern about that. You had mentioned children as being especially vulnerable. Are there other groups that you feel are at particular risk from these policies, and especially possibly from future policies that
Yes.
come from the government?
Well, I think children of a young age, especially pregnant women, is also a particularly vulnerable group. There are a lot of evidence for a lot of chemicals, for example, that have a pronounced effect on women during pregnancy, effect on the fetus, developing fetus. And the testing for those things is very complex. And one has, again, to identify the population being studied, and one has to ask what are the ways we can best. We need new methods for studying an exposed population, and I think that the elderly are another. For example, I use the example of air pollution, in which children are especially sensitive to the smoking in the home and the smoking in the environment that they live in if they have a potential for asthma. And that's a well-established medical fact. And so people who smoke around children who have a sensitivity to these chemicals in cigarette smoke potentially are exposing them to carcinogens. And the same holds for the elderly, whose risk of pulmonary disease is absolutely increased in the presence of air pollution of the sort that will result when we don't take into account the things that emanate from the burning of gasoline in our cars. So I think the protective measures that we have to take are considerable, and I'm very concerned.
Well, it's understandable. I think anybody who hears about this will also be very concerned. I'm making the assumption that this is for now at least, is primarily an American problem given our administration. Is that your sense as well?
Well, I don't think so. I think it may be primarily because here we are and here is the air pollution around us, but it's one world, and the air currents travel across to China and to Mr. Trump's Russia, and
these effects will spread.
They're worldwide. When we don't take into account the seriousness of the Endangered Species Act, it affects species around the world because these are migratory creatures.
Right.
And I think that so the climate change thing is a critically important thing. The air pollution thing is a critically important. The programs to detect chemicals that particularly affect elderly people, children, even the fetus, of course, particularly vulnerable as it's developing in utero. So I think all of these things are a piece, and the establishment of the scientific groups is in some disarray. A large number, for example, a number of key people have resigned from the advisory board of the National Park Service. Now, what's more benign and marvelous than the National Park Service? I mean, and yet the scientific board that has oversight over it is resigning in serious.
Right, and as you know, I've worked in scientific and medical editing for years. I'm retired now, but I have known people who were wonderful scientists who did focus on air pollution and its effects, and some of them have essentially limited their range because of all this.
Interesting.
Which is unfortunate.
It's important. Yeah.
So I have a couple of other questions for you.
Sure.
Are there, and I think this is kind of a general question, which I'll just put to you right now. Are there specific things that people can do who are concerned about this? Are there things that state governments can do? And also, what if you were a citizen concerned about these dreadful things that are happening? What is the right way to make it dent in this. I assume we should talk to our representatives.
Absolutely.
And I'll let you say something about that, but also, are there other steps we could be taking?
Well, I think it's a very frustrating. The question is, there is no simple. The answer is there's no simple response to that. It's a complicated issue, and I think what we need to do is to vote them out if they support these things, if they support withdrawal from the Paris Accords, if they support non-protection of the fetus and children of the future. I think when make representatives answerable to the population at large, and the major way to do that is through direct communication with their offices. The voters can write, and I think also they can stand down. They can be made to stand down if the population votes. People, these things are in our interest as a human species, and I think we have to protect ourselves from this atmosphere that we are now in. Obviously, one would like to restore the cuts that have been made in key programs, and one would like to reinstitute the custom, reinstitute the idea of having scientific credibility in what we do with the environment. And I think both of those have taken a serious beating at the hands of the administration. And I think people have to be vocal about these things. People are vocal about, the anti-abortion thing and all manner and immigration and the environment has to be taken, in my opinion, very seriously, because we are the ones who will suffer and our children after us.
Right. Well, I couldn't agree more. And luckily, we have local Massachusetts and other state representatives who are
very
working for these causes. And I guess all one can do is encourage them to keep doing
That's
it.
right. I think we in Massachusetts are really blessed, and we have a group of legislative people who are keen about this. But we have to, and I would like the message to go beyond the state of Massachusetts and we have to live our lives in a way. We have to do the things which will preserve the environment. We have to recycle. We have to do those things which are healthy and eliminate smoking from the right place. We're doing all those things, but we have to stay with that.
I think that's extremely helpful.
Good.
And I appreciate your coming and giving us,
nice
helping
to chat
us.
with you.
Yes,
nice to
for me too. And you have so much knowledge of this, and I'm really grateful that you're sharing it with
Pleasure to do
our
that.
listeners and viewers.
Sure. Good.
Great.
Thanks, Barbara.
Thank you
Appreciate it.
very much.
Thank you.